Good morning. Welcome to Rebellion Conversation for September. My name's Anna. This is Alison. One day I'm going to get this the right way around. This is Alison. We're part of the ProDog team. And if you would like to feel better equipped to take a more holistic approach to your dog's health and happiness, then you are in exactly the right place. We are going to be talking about Titre testing, which is an alternative to booster vaccinations. We have a guest, Jessica Case, who we're going to introduce in just a second. But just while we're waiting for people to join us live, welcome to those of you who are watching this back. As always, please feel free to add your questions in the comments. We do always monitor this page, so we will always get back to you. And also, I thought this morning as well, for those of you who don't know Alison, Alison is our canine nutritionist here at ProDog. She is in the Facebook group every day, answering your questions, helping you with your queries, and she's also available to provide tailored advice should you need it on your dog's nutrition. You can get in touch with her through our contact page on our website or via Messenger. That's right, isn't it, Alison?
Yep.
So if you, like I said, if you do need any advice on your dog's nutrition, on raw feeding, on any of our products or supplements to find out whether they are suitable for your dog's particular needs, then you can reach out and contact Alison. So with that, I shall introduce our guest. So Jessica Case, or Jess, is manager of Complete Veterinary Care, and they are the UK distributors of for Biogel Labs, who manufacture Vaccicheck, and she's been in that role for over 9 years. So she knows all there is to know about Vaccicheck. So we're going to dig into that topic in just a second and go through all those frequently asked questions. Jess also studied zoology. She's previously worked as a marine mammal researcher as well, which sounds so fascinating, Jess.
It was amazing.
Volunteering in small animal practices. So she is a total animal lover. She also has a 11-month-old Welsh collie called Roibus, who we've just been chatting about because I saw the most gorgeous photo of her. And her work colleague actually has her half sister as well. So their office HQ is sometimes overrun by Welsh collies, but beautiful dogs, both of them, from the photo that you shared with me, Jess. So welcome to you. Thank you for joining us. And just before we get into the topic, I just want to say to those of you who are watching, this live is not a statement about whether you should or shouldn't give your dog booster vaccinations. There are so many factors that need to be considered when you're making that decision, and we will touch on some of those throughout this live. But it's totally a personal touch. So the idea, it's totally a personal choice, I should say. The idea of this live is literally to share with you just the facts. The facts about Titre testing and Vaccicheck, just so that you're aware of the options that are available to you. So with that, we'll get into it, shall we?
Yeah.
So Jess, just to start with, the most obvious question really, what are Titre tests?
Titre tests are it's a blood test that will give you the immune response against the diseases that you're testing against. So it will give you a positive or a negative titer. The titer is sort of the level that's been determined through thorough research. If the response is above that level, then it's an indication that there is an immune response, that the sample has been able to produce antibodies against whatever it's being tested against. If it's below that level, then it is seen as insufficient response and therefore a negative titer. So it's a simple blood test that can tell you if there is antibodies sufficient or insufficient to provide a protective response.
Excellent. So what can you and what can you not Titre test for, Jess?
So you can Titre test. I mean, Titre test is just a type of test. If we're talking about Vaccicheck, there are 3 diseases that we test against. These are the core diseases that your dogs are vaccinated against. It's distemper, hepatitis, and parvovirus. And we test against all 3 of those with just one Vaccicheck test. So those 3 diseases, if you receive a positive titer, it's seen as a positive indication that there is a protective response. If you get a negative titer, it's seen as a insufficient response and therefore an indication that that patient is unprotected and could do with being vaccinated at that point. You could Titre test for leptospirosis. There are tests for leptospirosis available. However, we do not run a test for that disease because the duration of immunity after vaccination for leptospirosis is around a year. It does not have a long duration of immunity as distemper, hepatitis, and parvo do. So there is no point in running a titer test for leptospirosis. The test is available and you can run a test, but should you get a positive titer for leptospirosis, that is not an indication that there is long-term protection. That titer will drop off and the patient will become unprotected at some point. And so it would just be kind of a waste of time and money to run a test because it doesn't indicate long-term protection. Whereas for distemper, hepatitis, and parvo, a positive titer, there is now plenty of research to show that that indicates long-term duration of immunity. So you can rest assured that for at least the next 12 months, most likely longer, there will be protective immunity.
Yeah, that's great. So if we run a Titre for the core vaccines that we just discussed, and distemper was very low or there was no immunity, but parvovirus and hepatitis was, what would happen then? Would we suggest a revaccination booster for that 3, or could you potentially vaccinate just for that one particular disease?
It very much depends on the practice. There are not very many that will carry individual boosters. Most of them will have the combo that has DHP, all 3 with the one administration. There will be some that may have separate, in which case you can just vaccinate for distemper and go from there. What we would recommend if they don't have the individual is that you would still give the combo vaccine. Our stance is the risks posed by these diseases is much greater and much more likely if a patient is unprotected than the chances of there being adverse vaccination response. So our stance is, if in doubt, if there is a negative titer, to revaccinate, even if it means revaccinating against diseases that they are positive for, because the chances of adverse reactions is smaller than the risks posed by these dangerous diseases.
Yeah, great.
And so, Jess, this is like I was saying at the start before we went live, this is really timely for me because I'm just at the point with my own dog where I'm looking into the options for him because he's due next summer for his booster.
Mm-hmm.
For the 3 that we were just talking about. So in terms of the actual practicalities of having the test done, what does it involve? So
okay. So I can talk about this with the kind of in the context of my own puppy. We have an 11-month-old Welsh collie, as you mentioned, called Rooibos. So Rooibos, when we got her from the breeders, she hadn't yet had any vaccination. She was 10 weeks old. So she had her first initial vaccination at around 11 weeks. Then she had her second at around 16 weeks. And with her second set of vaccinations, she did have a bit of an adverse reaction. She was lethargic. She had a bit of a fever. She went off of food a bit. She was, you could see, not feeling herself. So when it came time for her third, which they wanted to give at 20 weeks, I decided, because at 20 weeks, you can be assured that there is no more maternal antibodies in the patient's system. It had been at least 2 weeks since her last vaccine. So I knew, because it's important to consider these things, a Vaccicheck test can't distinguish between maternal antibodies, which are found in the puppy system. It can be up to 18 weeks. They can still have MDA, it's known as, in their system. And if a Vaccicheck test is done earlier than this age and you get a positive titer, you cannot assume that that is the puppy's own response. It could be picking up on the maternal antibodies, in which case that's not an indication of long-term protection, because the maternal antibodies will drop off. At 20 weeks, though, you can be sure that a positive titer is an indication of the puppy's own immune responses, their own antibodies, that gives that positive titer. And it had also been at least 2 weeks since the last vaccine had been administered. If it was earlier in this, then there's a risk that Vaccicheck is picking up on the vaccine antibodies and not the pup's own immune response. So again, you need to bear that in mind. So 20 weeks and at least 2 weeks since her last vaccine. So I decided she'd had a bit of a funny response to her last vaccination. Let's run a test instead and check, does she actually need to get this one at 20 weeks? We ran the test. She came back as positive titers. So we knew, okay, she has protection. She doesn't need to get this next one at 20 weeks. The vet was fine with that. So she's had 2 sets of initial vaccinations. She's returned a positive titer. We're now coming up to the time where she's due her 1-year booster or her first booster, it's known as. Our decision on this is that we will be giving that 1-year booster. The reason for this is research shows that puppies' immune systems are not fully mature until around 6 months. So their puppy vaccinations are given with an immune system that's not quite mature yet. It gives a protective response, but I want to make sure that Rooibos has a nice, strong immune response. And for that reason, I want to give her just 1 booster for distemper, hepatitis, and parvo, where she's over 6 months, so that she can give a nice, strong immune response, and that should give her a long duration of immunity. So research shows that the duration of immunity for most patients will be at least 7 to 9 years, if not their lifetime, for distemper, hepatitis, and parvo. That research was done with patients that had had their initial vaccinations, including the 1-year booster. So that data was done with patients that had had that 1-year booster. And the general consensus is that it's a wise decision to give a booster with a mature immune system, so that you get a strong response. And then from there, you can go on to Titre test for distemper, hepatitis, and parvo, and make informed decisions from there. So for Rooibos, we'll be giving that 1-year booster. I will then, we don't need to do anything for distemper, hepatitis, and parvo for the next 3 years. So she won't have anything for 3 years. At the 3-year mark, I will Titre test, and we'll see, does she have an immune response? If she comes back positive, I'm going to then continue to Titre test annually. Our recommendation is to test annually after that 3-year mark, just to make sure that she has an immune response. She's going to be going in annually for her lepto anyways, for an annual health check. So at that point, we're going to run a DHP test, make sure that she returns positive, and then we have peace of mind that for at least the next 12 months, she is protected against those diseases.
Yeah. I mean, yeah, that's really good advice. It's like with me, as I say, I Titre test my own dogs. Like you say, not necessarily annually, every 3 years, which is what the World Small Veterinary Association for those particular vaccines is every 3 years, I believe, isn't it? But I still take mine for a full health check once a year. With the vet. Still do. Just to be, obviously for my insurance perspective, and also, to chat through with my vet that I've got a good relationship with, any concerns I might have, check them over weight-wise, health-wise, everything. I just think that's really important to do that anyway.
Yeah.
And so, Jess, you've answered my questions, because that's exactly where I'm at the stage that I'm at with my dog. Is he had his annual booster, his 1-year booster, and we're now coming up for his next one. So, for me, and this is what I was saying at the beginning of the live about, your personal circumstances, and, there's a whole load of things that can factor into your decision about this. And for my dog, he's very reactive, and he doesn't respond well to being handled. he doesn't respond well when taken to the vets and being examined. And so it's debatable whether they are going to be able to test him, because obviously it involves a blood test, which requires a little bit more handling over a slightly longer time than administering a booster. However, I have found a fantastic vet who are willing to try and attempt it. And they also offer, and this is the thing, I think it's just inquiring with your local veterinary surgeries to find out what they do and don't offer. But at mine, they do offer confidence clinics where I can take him in on a few occasions, just to help him get used to being in the vet clinic, being handled, and just try and gradually get him used to that. So, but at the end of the day, if we are unable to do it because it's too stressful for him being handled, then potentially we may not make that choice. But that just goes back to what I was saying at the beginning about it being a personal choice for people.
Well,
the good thing about Vaccicheck is that it requires a very, very small sample as well. It only requires 0.005 mils of serum or 0.01 mils of whole blood, which is what you draw out. So it's a tiny sample amount. So for your dog who's stressed, it means that they can even do it with an ear prick or a nail clip. It's a tiny sample amount. So hopefully they can get that quickly. You can run the test and make sure that he's protected, and you don't need to worry about stressing him out with boosters.
Yeah, fingers crossed.
Yeah. So as I say, we did sort of have questions regarding sort of how Titre tests compare with boosters cost-wise, but every vet clinic's different. We sort of advise, obviously, you've got the north-south divide where generally the south is more expensive than the north. But as I say, I found personally that my dogs having boosters stroke Vaccicheck Titres are roughly around about the same. But every vet's, just phone your vets and just check. That's, I
would say to always check that you are asking for a Vaccicheck test. So Vaccicheck is a brand name of a Titre test. There are a number of different Titre tests available. There are a number of different immunity tests available. Some of them are very, very expensive for the exact same thing. So I would always check with your vet that you're being quoted for a Vaccicheck test. If they don't know what a Vaccicheck test is, you can put them in touch with us and we can pass on all the information to them. Vaccicheck is a brand of Titre test, so there's a chance that they don't know, or maybe they used it in the past and they forgot about it. Maybe they had a locum vet that used it in practice, but check that it's a Vaccicheck test because it does tend to be the most cost-effective Titre test on the market.
Yeah, definitely. And we will put a link below to your map that you've got on your website, which shows all the current vet practices that do use Vaccicheck. So that's really good.
Brilliant. So I think that's it in terms of the questions we wanted to chat through. I mean, like we were just discussing, your personal circumstances and lifestyle may sort of dictate to a point whether Vaccicheck will be an option for you. I mean, if your dog does, for example, need to go into kennels or boarding, you'll need to check with them as to whether they do accept Titre testing opposed to proof of boosters. They all vary. I think it depends on local authority regulations in terms of their licensing, but it's always worth checking and asking that question.
Yeah, as I say, you've got kennels, daycare, dog walkers, all these considerations that you need to sort of weigh up the pros and cons. And also, like you say, if your dog does struggle with some reactions from the boosters, then it's great that there's an option there that you can have peace of mind by Titre testing to make sure that your dog is still immune to these core diseases, which I don't know whether anyone's ever witnessed or seen a dog that's certainly had parvovirus. It really, really is horrendous.
Awful.
horrendous.
Awful. Yeah. And that's one thing as well, you know, because there is now an affordable test available, you can use it to make vaccination decisions, but it's kind of multi-use as well. So, for example, I know that this year there were some pockets of kind of increased parvo cases, and we encourage vets to say, look, if you're seeing parvo in your area, maybe encourage owners to come in and you can run a Vaccicheck test and make sure that your dog is protected and has immunity there. So you can use it if there's disease outbreak. You can use it for stray animals that you maybe don't know their vaccination history. You can run a DHP check and see, do they need to get vaccinations or are they protected? For lapsed vaccination protocols, it's great for that. For dogs that are on immunosuppressant treatments, you can run tests for them and see, do they need to get boosters or not? Because it's an affordable option now, it's multi-use. You can use it kind of as and when to make informed decisions about what vaccinations are needed for your dogs.
Yeah, definitely. It is a great option. And I say it's always worth checking with your dog insurance, your pet insurance, should I say, as well. The small print in there, or just give them a call. I mean, generally, I've always found that if you've got a positive certificate from a Titre, they'll accept that. Many of them do now. But yeah, it's always worth checking the small print, you know, in your own time, just to double check. And you know, you might decide then that you want to change insurance providers to one that does accept that.
Brilliant. Thank you. Great advice from both of you. Thank you to those of you who are watching. Thank you to those of you who are watching this back later. As I've said, if you've got any questions, add them into the comments. We will get the answers for you and we will get back to you on them. But that's it for now. Thank you. Take care.
We've got all the links.
Thanks very much.
Well. All right. Thank you very much, Jess. That's brilliant.